Hey everyone, Odile here. I'm hoping that this is finding you well. So September is self-care month and we're pretty deep into September, but I'm a firm believer that every day, not just every 1 month a year, is a great time to put attention on our self-care. I have to say that self-care varies for me personally, and one of the things I actually really love about these videos, or the opportunity to use videos to communicate with you all, is that it can be kind of informal. And in the same vein, I think self-care can be kind of the same deal. In other words, it doesn't have to be some big, luxurious, you got to take half the time out of the day, not half the time, half the day out of your day to do something that is self-care. Self-care can be lighting a candle and taking a moment to just reflect on your day, or somebody you really love, or something that made you feel really good during the day. It can be a formal meditation, it can be a walk, it could be exercise, it can be getting a massage, it could even be going to the doctor's appointment that you've been putting off doing. So again, it doesn't have to be really formal. I'm going to show us a stretch or a couple stretches with some tennis balls and our yoga strap, very simple, that I actually really love to do when I can. First thing I do when I get to the studio in the morning, I try to do these stretches because they feel so good and they really open me up and prepare me for the day. They're actually fantastic to do at the end of the day, so especially if I've done a lot of body work, I've been standing up all day, it's a really fantastic way, so I'll get to that in a minute. Lie down, but before we do, so here we are. I purposefully chose my bedroom because I kind of wanted to demonstrate that you could do this anywhere. So here are some tennis balls. The tennis balls are going to go, here, let me kind of tip my screen down a little bit. The tennis balls are going to go down at my, kind of the squishy parts, not on the bony part. So if you want to kind of feel your body, you can feel that this is the center of your spine there down at the bottom. It's called the sacrum. It's 5 fused vertebrae. So those are not where you want to put the tennis balls. You want to put the tennis balls to the side of that space, and I will talk about what that correlates to in the front body in just a moment. So notice how kind of I'm out on the sides, I'm off the bone, I'm off to the side, and that's where I want to feel that the balls will land. So when I lie back on my back, and the ball's going to go again to the side of the bones, one on the right, one on the left side. So what that correlates to in the front body is, if you can feel with your hands again, lots of feeling, right? If you can feel with your hands again, your hip bones, right? Not your thigh bone, but your hip bone. And you kind of walk down a diagonal line along your bikini line there. And you walk down and you'll feel like it's kind of thick and tendony. And then at some point there's kind of a little bit of a drop off, is the way I kind of describe it. Right into that sinkhole or that drop off, that's where your thigh bone enters the hip cup. And you want the ball to be kind of behind, directly behind that spot. Okay, one on each side. And so there I am. So the first thing we're going to do, I'm just going to move my arms out of the way, but I'm going to recommend you're going to rest your arms by your side. But I'm going to do like this so that you can see. I'm just going to gently tilt my pelvis in a forward direction. So I'm reaching my pubic bone towards my feet. It's not a very big move, and man, it puts a lot of stretch and sensation on my sacrum. So I'm going to go one direction and the other. And I'm just going to feel my muscles and kind of the soft, fleshy parts, right, of that area. As the ball is touching them, get a little massage. So I'm kind of arching forward, as they say, pelvic anterior tilt and posterior tilt. And you can get your back all the way back onto the flatness of the mat itself, but don't let your butt lift off of the balls, right? So you're going to really stretch forwards and backwards, and then we're going to come to center. All right, so we're going to take in a nice deep breath. letting the weight of our body kind of sink into the tennis balls. Now, quick caveat, if you have sciatica or if you have piriformis syndrome, you're going to want to be careful. And if you have sciatic type symptoms or sciatica, please be extra, extra careful with this. This may not be the movement for you, or it might be really wonderful, especially with piriformis syndrome, which is essentially a very tight kind of glute muscle that holds on so tightly that it doesn't allow the sciatic nerve to kind of move through with ease. And so because of that constriction, there can be some pain and some referred pain down the leg. So if that's your diagnosis from your doctor, do this with a lot of caution. You might want to check with them first, or check with your Pilates instructor, or email me and ask, and we can have a conversation about it. Okay, so now I'm going side to side. So I was going forwards and backwards. Now I'm tilting onto my left hip and onto my right, and I'm just giving myself a little massage as I go side to side. And of course, the sweetest spot of the self-care practice is the breathing. So as you breathe in, you kind of soak in, sink in. As you exhale, you release the tension. A couple more on each side. And then you're going to go around in a circle. So I'm noticing that even as I'm on my right side, I'm on my right and my left side, my right side doesn't really want to release. It's definitely holding some tension. So I'm just going to keep observing that. And now I'm going to go around in a circle going the other way. And I'm breathing. This is a great time to kind of light a candle if I could, right, in the dark, or make the room kind of nice and real quiet, put on some relaxing music. And that could be just a wonderful 10 minutes of self-care right there. Okay, so we're going to take the right ball out and only have the left ball under. Now I'm going to move up my screen a bit. Okay, now I'm going to keep the ball where I had it, but now I'm going to open my left thigh and close. Oh yeah. So before we were moving our pelvis and keeping our thigh still. Now we're keeping our pelvis still and moving our thigh. So this motion is lubricating kind of the ball in the cup, where the other one was the cup lubricating on the ball. So those two surfaces need to have a really great relationship with each other. And sometimes we can be really overly flexible in one area, but the other can become really restricted. So we want to do a little bit of both. Okay, and if you're feeling like it, you can bend your knee, put your hand on your leg, and do little circles. Okay, make sure you go both directions, and taking a nice, deep, big, luxurious breath. So there's a luxurious right there. Like you're smelling a really sweet, wonderful flower or one of your favorite fragrances. Okay, and bring that down. So before you go to the other side, whoa, I can really feel that gentle release around the gluteals, not even realizing how tight my gluteals are. So I'm going to turn around, but you guys can stay right where you are. Sorry for that. And we're going to put now the ball, same spot, right? But now I'm on my right side. So I call this butterfly wing because I imagine that my leg is like a single side butterfly wing opening and closing. And I just keep that opening and closing. And it feels really, really good. And maybe you need to be a little bit higher or lower. The other thing you want to be mindful of is that your hips aren't moving, right? So the hip isn't moving, it's your thigh that's moving. So my left side is staying equally level with my right. Couple more. And I'm going to take that out. And I'm just going to straighten my legs You can't see them on the screen, but my legs are nice and long. My shoulders are relaxed. And I just breathe here 5 big breaths, allowing my sacrum and my pelvis to restore their balance into their natural position. So I breathe in, really feel the breath down into the pelvis, even breathing into my belly a little bit so the whole pelvic bowl expands, and then I exhale and release the tension. 4 more breaths. And remember, the intention is self-care, not just quickly getting through it. So take it in, right? You're drinking in, you're soaking in, you're soothing your body. Inhale, 3 more breaths. Two more breaths. And last big breath. Okay, carefully rolling over to one side and come on up. And that's it. So I hope that this was kind of encouraging you to take a moment to do your own self-care. And if you needed some assistance or some ideas, here it is. Have a wonderful rest of your day and continue to take care of yourself, not only in September, but every day of the year. All right. Love you all. Bye.